discussing anatomical position and organizing the body's movements into different regions and areas of motion for clarity and scientific consistency, it's important to understand the three main planes of motion. However, before discussing the planes themselves, it is important to be familiar with other anatomical terms to understand the scientific language and how their use makes analyzing the body's anatomy easier. To start, directional terms should be discussed. These are terms that describe the different angles, sides, and positions in the human body. I am standing in anatomical position, which means standing erect with the arms at the sides and palms turned forward. Superior means towards the head or upper part of the structure. Inferior means away from the head or lower part of the body. For example, the shoulders are superior to the stomach and the knees are inferior to the waist. Anterior means towards the front of the body, and posterior means towards the back of the body. For example, the nose is anterior to the back of the head, and the back is posterior to the chest. Medial means towards the midline of the body, and lateral means away from the midline of the body. For example, the pinky is medial to the thumb in anatomical position, and the lungs are lateral to the heart. Proximal means closest to the point of attachment, and distal means further away from the point of attachment. For example, the wrist is proximal to the forearm, and the foot is distal to the knee. Superficial means towards the surface of the body, and deep means away from the surface of the body. For example, the ear is superficial to the brain, and the heart is deep to the skin. Now it's time to move on to the planes of motion. The first plane is the sagittal plane, a lengthwise plane running front and back. It divides the body into right and left sides. What I'm performing now is flexion and extension, decreasing then increasing the angle of my two arm bones. This is movement categorized in the sagittal plane. Another movement in this plane is dorsiflexion, moving the top of the foot toward the shin, and plantar flexion, moving the sole of the foot downward. The next plane is the frontal plane. It is a lengthwise plane running from side to side. It divides the body or any of its parts into anterior and posterior portions. Some exercises working within this plane is adduction and abduction, motion towards and then away from the midline. Another exercise is elevation and depression, which is moving to a superior position at the scapula, then moving to an inferior position. Inversion is lifting the medial border of the foot, and eversion is lifting the lateral border of the foot. The last major plane of motion is the transverse plane. It is the horizontal or crosswise plane. It divides the body or any of its parts into upper and lower portions. Rotation is an exercise that works within the category of the transverse plane, turning about the vertical axis of the bone. Pronation is rotating the hand and wrist medially from the bone, and supination is rotating the hand and wrist laterally from the bone. This action works under the transverse plane. We already covered adduction and abduction, but it can be applied in the transverse plane as well as the other two. An example of horizontal extension and flexion is flexing the humerus towards the midline horizontally and then extending out from the middle. We've now covered anatomical position, the three planes of motion, and various exercises that work within these planes.